Hi, Sherry.
How's it going?
Very well. Hi, Zainab. Hi, Sherry. Nice to be with you
Hi.
both.
Yeah, nice to be with you as well. Thanks for being here.
It's a pleasure. It's good to be here.
Yeah, I apologize. I think because of the time zone, some people might not be able to make it, but we're hopefully trying to make into a learning series and we'll distribute it through our channel.
Okay, sounds great.
Yeah, we have attendees from across the globe. We gained a lot
Wow.
of traction in Africa. So, for example, super excited.
Wow, that's very, very cool. Well, good. Well, tell me a little bit about yourselves while we wait, Sherry and Zainab.
Yeah, of course. So I'm Sherry. I'm a second year, well, now third year bioengineering PhD student at Stanford, working on machine learning for rare disease diagnostics.
And I'm Zainab. I'm a second year undergraduate working in human biology and excited to be here.
Cool. Awesome. Okay, yeah, so I'm gonna get started because we have a short session today. I'm gonna first start to introduce to everybody a little bit about the Stanford Healthcare Design Challenge. So welcome everybody. Thanks for joining us today. So as you know, we are a hackathon challenge, and a little background is that only 7% of projects had any activity 6 months after a hackathon end. And we want to change that reality at SHDC. We're a for student by student initiative designed to move the needle in healthcare. We want to bridge the ideation to implementation gap with industry engagement and mentorship. And there are a ton of resources at our org. We want to democratize knowledge through open learning series, expanding access through the vast mentor pool, and engage with industry decision makers through our judging panel. I want to also highlight that our org wants to offer a 3-month critical support post-competition to help the teams advance to actually make their ideas into real actionable results. Let's meet the team. So we're a group of 12 from Stanford, from various schools at Stanford. We have law student, med student, MBAs. So we are very diverse. We came from very diverse background. I want to thank the team for their tremendous effort in making this happen. And we're always looking for more talent and partnerships with any institutions. So please reach out if you have any ideas or you're interested in joining us. So last year, our theme was around social determinant of health. That was our inaugural challenge. This year, we're going global. And our vision is to have a design challenge with global reach and impact for any student, any university, anywhere. So here is our 2025 prompt. The goal is to design a financially sustainable and scalable healthcare solution that addresses the healthcare needs of a population experiencing geographic transitions. Specifically focus on the needs of a group of people experiencing either voluntary or involuntary migration within a domestic or international context. You can also scan our QR code to look more into our website, which has the full prompt. Here are some of the key dates. So we're currently in the September Learning Series, and our prompt has already been released. The application is due on September 22nd, although we do encourage you to attend as many learning series as possible before your application. And lastly, the demo day is on October 17th, where all the teams will come together to showcase their product. And here is our September Learning Series. We're on September 4th today with Amir, and we have a full month of programming coming up. So make sure you come to attend these sessions. And without further ado, let's return to our Learning Series programming. So I'm going to start off and introduce Amir. Amir Rubin is the CEO and managing partner of Healthcare Capital. He dedicated his career to transforming healthcare technology through technology, innovation, and human-centered models of care, with leadership experience spanning One Medical, now part of Amazon, United Health Group, Stanford Healthcare, and UCLA Health. Amir has successfully advanced scalable care delivery, digital health, and population health initiatives that have reshaped the healthcare landscape. His experience leading health initiatives that have shaped the health that expanded access across geographies, built culturally responsible models of care, and integrated virtual and in-person services demonstrates how innovative delivery models and sustainable business approaches can close gaps in access and equity for diverse, mobile, and underserved populations. Amir, thank you again for your time and for being with us today.
Well, thank you. It's great to be with you all and good to be with the group here and excited about what SHDC is doing. What a great thing. So redesigning healthcare is kind of what I've committed my career to, and we haven't done it yet. So it could be this team, this group of people is the ones that are going to take us to the next step. And what I thought I'd do is share a little bit from my perspective on how I look at designing for impact and what are some of the key components that I've thought about now leading a venture capital firm, but also having worked in a startup, a tech-enabled startup, One Medical myself, and then in kind of legacy health systems, being at Optum or Stanford or UCLA before that. And I'll go through a few key areas that I've thought about as I've thought about designing for impact. The first one being the alignment of the purpose and the problem definition with kind of your product and the market. The second area being, okay, I've got a solution that ties to a purpose and a problem and a market. How do I actually distribute that, acquire and retain the customers? The third key issue is, what is my economic model for this? How do I make this a sustainable effort? How do I think about growing it and financing it? And then how do I think about execution? And each of these areas I have found to be critically important. And any of them can define your success, but any of them can also drive your failure. And we could talk about that in conversation as well. So starting with the purpose or problem definition and then tying that to the product and market, really the point here is, and certainly in this example, we have a prompt. So we have a little bit of a purpose or problem definition teed up, but that prompt is still pretty wide, right? And generically, going beyond this prompt, as you think about what you're looking to solve, think about that problem statement and think about it from different directions and different perspectives. And often I find, and this is kind of a design thinking tenet, don't necessarily fall in love with your first idea. Think about all the different components of it. And, you know, from Healthier Capital, I've launched a venture firm 1.5 years ago. We have a broad purpose, which is to advance healthier outcomes for all. So that's pretty broad. And how did we cascade that down to a more specific purpose? Well, we took the problem statement of the key stakeholders in healthcare, and we see, gee, consumers are frustrated on the demand side with their experience and access. Employers and payers are frustrated with medical inflation and waste. But we saw problems on the supply side where providers are burning out and there's shortfall of clinicians and staff. And then we see this challenge around certainly the US, but around the globe, of an aging population, and how do we coordinate that care? So we took a high-level mission, defined the problem statement that we are working around in our venture firm, and then we focused it on solutions areas for us, particularly around technology-powered solutions to these key stakeholder problems. For example, better consumer experience and access, better care value and clinical service innovation on the demand side, or administrative and clinical automation, or software and tech-enabled services. And then we looked for products that solve these problem statements, so that aligned with our purpose, down to problem definition, and then looked where are their big problems. For example, this is a company, Hyro, in contact center or call center automation. Patients have questions, and it's hard to get those people to answer those questions. And Hyro is automating through an agentic AI, conversational AI platform, to get a flavor of it.
Thank you for healthcare. I'm Carrie, your AI agent. How can I help you today? Hi, I'm an appointment with Dr. Dr. Smith, but I don't remember when it is. Sure, I can help with that. If I get the patient date of birth and zip code, birthday is May 23rd, 1997, zip code is 98052. Would you like me to confirm an appointment? No, actually, I can't make it. Just Smith has availability in the next 2 weeks. Would you like to reschedule instead of canceling? Yeah, that'd be great.
So I'll move ahead in the example, but give you a flavor. Or this is another company actually from a Stanford entrepreneur, Metaloop, that is an agentic AI analytics platform. So for example, a health system or a health plan or a researcher can just type a question. For example, how many patients who experience a stroke receive rehab within 90 days following the stroke? And this system thinks like a sophisticated analyst. Well, first it'll validate the query. Oh, by stroke, do you mean cerebral infarction? By rehab, do you mean occupational therapy and physical therapy? Would you like to accept or edit this? Each of these steps is an agent writing Python code, then an extraction plan, then a statistical plan, then an output plan, then finding procedures and diagnoses codes automatically, then running the query, giving you histogram, bar charts here, statistical confidence interval, and follow-up questions. So an example of going from high-level mission, delivering healthier outcomes for all, defining our problem statement as a firm, the needs of key stakeholders, our solution set, looking for technology-powered approaches, and then looking for companies. And I'll show another example. This is from One Medical, the last company where I was CEO, where we were modernizing primary care, and we had several key components, and we were solving for several stakeholder problems, but I'd say at the crux of it is the consumer was frustrated with access and experience. And so we created a membership model, a subscription, which allowed people access in person or remotely. We built our own software that people can get online and engage. We built physical locations. We had a salaried staff model for clinicians. And then we thought over time across the journey of the patient experience. So, so that's a little bit about thinking of the problem and the purpose. I'd say the other thing too to keep in mind is what's happening in the market. And we're in an exciting innovation cycle in technology, and you could define these cycles in different ways, but we might be in a wave now of AI, right? We certainly started with water power and then went to steam and rail and steel through electricity, the combustion engine, petrochemicals, digital, and now certainly AI as a next generation. So obviously, this is one big exogenous change in the market. So the other thing that really one should think about here is don't just get excited about the problem and the purpose. And a lot of companies say, I'm passionate about this. Well, that's great, but also be aware of what's happening in the ecosystem around you. And it used to be that these innovative new ideas took a long time to diffuse. But things like ChatGPT reached 100 million global monthly active users in 2 months after launch. So there's exciting things. And if you look at some of these technologies, already you're seeing AI performing better than humans in things like handwriting recognition, speech recognition, image recognition, reading comprehension, language and code generation. So you can start thinking about, gee, what's happening externally? And even as I fall in love with my purpose and passion and the problem I'm solving, am I keeping up with what's happening in technology? I'm going to move ahead here a little bit. The second key area is to think about distribution and customer acquisition and retention. So, all right, I've got this great purpose. I got this great prompt from the Stanford Healthcare Design Challenge. I've understood the market. I've understood changes in the market. I've defined that sub-market, right? This is a big prompt. Like, which aspect do you want to solve? How do I get to that market? Can I get to that market? What is the cost to acquire a customer? Can I retain that client? And this is why I said you can have a great purpose. You could even have a big market. And by the way, a lot of people in the venture world are often targeting markets that maybe are too small, or they're assuming they're going to get 100% of the market, and they're assuming it's going to go viral. What does that mean, right? How do you acquire these customers? So this is a big challenge. I'll talk about One Medical a little bit. So we started off as a direct-to-consumer, a B2C company. People would go online, hear about us, and sign up to be a member, which was great. But frankly, how we really grew was we went B2B. We hired salespeople and we called on businesses who said, hey, we're going to offer One Medical as a benefit to our employees. And then we had to figure out, how do we fit into insurance benefits? How do we accept insurance? How do we sell to benefits leaders? How do we demonstrate that this is valuable for an employer? For example, we published this paper in JAMA Network Open that showed for one employer, we took down the total cost of care by 45%, very big reduction. And we published that we had 2x the kind of outsized results in, for example, hemoglobin A1C reduction for diabetes reversal. But we liked B2C. B2C is expensive. And ultimately, Amazon acquired us and put us on their homepage. And that certainly helped us to grow B2C. And so now One Medical is an add-on in the US to Prime membership. And so think about distribution, B2B, B2C. How are you going to reach your customers? And I just threw in this last night as I was putting my deck together, because they have big logistics. But now we'll have One Medical painted on the side of Amazon delivery trucks or boxes. Certainly helps with customer acquisition in a way we couldn't do on our own. And this is one of our portfolio companies, Ezra. This has AI that can reduce the time in the MRI scanner. And they had two thoughts. They had a B2B thought, which was, hey, I'll sell this software to imaging centers and reduce the time in MRI scanner, and they can accelerate their scanners, which was great. But actually, they also had a B2C where consumers can get on an app and book a scan. And that actually ended up taking off. And they now have combined with a company called Function Health that does B2C, largely direct to consumer, get on an app and do clinical lab tests, now MRIs and other genomics. And now they have a back end kind of AI, I'll call it AI doctor. It's not quite AI doctor yet, helping you on your kind of well-being plan. So think about distribution, and then think about the economic model. And again, this could apply if you're a nonprofit or for-profit. It doesn't have to be a huge economic model, but how is this going to sustain itself? How is this business going to work? How are you going to fund it routinely? This is one of our portfolio companies we just invested in, Daymark Health, which is a tech-enabled platform for cancer care coordination. Basically, with cancer patients, there often is fall off between correctly diagnosing the patient, treating their symptoms, and sustaining care after symptoms. So much so that on these very high-cost drugs, about 50% of patients fall off of them, and there's a lot of excess emergency department visits. So they have a holistic clinical model, and they combine in-person care and virtual care. And basically, their clinical model is, we think we can save 20 to 30% of the total cost of care by getting patients on the right treatment and avoiding the emergency department costs. And their economic model is, hey, who's incentivized to have this perform better? Largely the health plans. Or here's another one of another Stanford entrepreneur, Qualified Health. This is a company that builds, if you will, Gen AI apps on top of health system data for health systems, and allows them to, instead of procuring dozens or hundreds or thousands of apps, to build these kind of apps in minutes, and then have a monitoring system for these. So the key things here to note is, what is your economic model? Who's incentivized by that economic model? And then how will you get margins or economic value out of that model? So it's great to be driven by a purpose. It's great to define that problem. It's good to understand the market. We need to think about distribution, and we need to think about the economic model. But still, it may be hard to grow or finance this. How cash intensive is this business, or is it not? How attractive is it to investors? What does it take to grow and finance it? And here are some of the criteria I think about as an investor. So I divided these into kind of external and internal factors. For ourselves at Healthier Capital, we'll often start with, hey, who are those key stakeholders and how are you addressing? What's the value you're delivering? What's the market size? Is there a fit between your product and the market? Are there other competitors or easy substitutes? People often forget this. Yeah, that's great, but can anybody do this? What's the economic model? What's the go-to-market? And how do we grow? But then also, what does it take in terms of the leader and team? How scalable is this idea? What will it take to sustain it and execute it? What's the margin profile? How much capital or cash is this going to use? What are the risks here and the skills that are needed? What happens to this company in the future? And then as an investor, do we like the price? What does it cost to invest in this? And then finally, you can do all of that, but then execution and the right team is hard. And so I wouldn't trivialize this. And throughout my career, I've used approaches like we use at Healthier Capital or One Medical or Stanford. Now we call it HOPS, with a healthier operating system. And really what this is we think about execution on a few key ways. First of all, strategic and alignment and deployment. Can we cascade our purpose into our strategy, into the key steps we're going to do? How crystallized can you make that? And as you grow as a company, the more unclear that is, the less alignment you have in a company. The more clear our purpose is to do this, we do it through these things. Here are the work we do. Here's the initiatives we're taking. Here's the metrics we have. Here are the goals. Second key step is how do we continuously improve and innovate on that? Well, that's good, but as we saw, technology's changing, the market's changing. How do we make sure we build in processes for continuous improvement, whether it's lean or design thinking or agile and software development or other approaches? How do we continuously learn and improve? And the third key component is what we call active daily management. It's great to have goals aligned. It's great to continuously improve, but how do you know each and every day we're sustaining and scaling and executing performance? And that is, for example, do we define the work we're doing very clearly? Are the work steps defined clearly? Do we go talk to our customers clearly? Do we get feedback? Can we A/B test? Can we, if we're in a physical environment, can we huddle and round and observe and have continuous loops? And then for myself and in the firms I've worked with, we have our service philosophy we call CI Care, which is in the middle of everything. And at some level, CI Care is how do we engage with empathy? How do we connect? How do we introduce ourselves? How do we communicate what's happening and why? How do we ask permission? How do we respond? And how do we exit with gratitude? And whether we're building software, we want it to be humane and human-centered. At One Medical, our mission was human-centered and technology-powered healthcare was really the focus. And at Healthier Capital, we're doing this through investments, but we think about how do we do things in a human-centered and technology-powered way. So in summary, as I think about designing for impact, I think about purpose, problem definition, product and market, distribution, customer acquisition, retention. Think about that economic model. How are we going to grow and how are we going to finance that growth, and execution and team. So I know I went through a whirlwind of things here, and I tried to save some time for Q&A.
Thank you so much, Amir. That was, wow, I think you hit like all the major points there. I'm sure the audience probably have a lot to take away, and I would encourage the audience to ask questions in the chat, and Zainab would maybe help bring some of these questions up. I think you brought up really interesting points. I guess for me, I'm going to start off with a couple of questions and think about how we can kind of tackle it from the angle of serving the migrant populations. So you brought up a lot of points about, for example, scaling the care models, like how One Medical shift from B2C to B2B because it's really expensive. I guess when you think about the migrants populations and the displaced populations, what strategies from that experience can be adapted to ensure that this population who face limited access can consistently connect to care?
Well, I think about in any population, think about the current workflow or current cultural norms or current beliefs, like how does it fit into how people currently believe? So in the last month, I've been both in Guatemala and Rwanda, two very different systems. Did a number of things, some travel, but also engaging with their healthcare ecosystems at various different levels of economics. And, you know, what is the routine way that people access information? What is their daily workflow? This is where actually going, to use the Japanese word, going to the gemba, going to the factory floor, seeing the workflow, and what people believe in, what are cultural norms. I actually have a friend who's has some kind of quick stop in healthcare for people in Mexico and Latin America here in the US that's picking up on cultural norms from their home country. So what are people comfortable with? Now, I would also say, don't prejudge people. Oh, this person comes from Rwanda or Guatemala, they must want this. You know, as I always say, people aren't stupid. You know, they may have different educational levels, they may have different access levels or income levels. But I think understanding that journey map, that experience, how people access things today. Now, certainly if somebody's displaced or on the go, there's a heightened level of duress, right? And probably a heightened level of immediate needs. But still, I would look at what are the ways that people access information, access clinical care. In a lot of countries around the world, people go to walk-in pharmacies. People go, you know, they don't need prescriptions in the same way. They may use herbal approaches. There may be local people in communities. And there may not be, my wife's been involved with a group that's worked in the Congo, where there isn't a lot of doctors in some of these areas. And so they've created apps that give clinical guidelines. Also remember that the regulatory environments are different. Sometimes they're maybe looser, maybe that's an advantage. Maybe we can roll out the AI doctor in one country because the alternative is nothing, versus in our country where the alternative is a lawsuit, right? So, yeah, I think that's going to understand the user experience, understand, yes, their cultural, but also just their work patterns, their norms, how they interact, where they get information. And by the way, taking that back to the US as well, it's hard to segment customers like, oh, every person of this background is going to believe that. That's where I'm like, well, I'm not sure that's true. Actually, I believe that's more not true, frankly, in my experience. So, like, then you start thinking about, and that may be true-ish in distribution, B2B versus B2C. You may, but then you start thinking, okay, well, what do I need to do in my product to make it be able to flex to different, you know, approaches and people?
I see that. Yeah, that's certainly true. You have to like think about the local context. I was curious though, like if we were to think about this problem in the US, when we have like people who maybe like are adopting like new identities legally, for example, how do you see the private sector and maybe the policy sector work together to be able to put together like a solution? Because like sometimes partially it's just like the more logistical things like navigating the language and understanding how system works, but also how do you like incentivize different stakeholders to provide that service for this group of population who are maybe new to this country?
Well, I think a few reflections. Maybe let me go back to One Medical a little bit. So for those who don't know, One Medical is a modernized primary care organization that has two components. So it has a membership, it has a subscription. So for less than $10 a month, now on Prime, you can ask any question asynchronously or a synchronous quick video chat with no copay, no deductible, no bill. So ostensibly you have no insurance. I've actually heard people from out of the country, they said, I just came in and I just used One Medical. because
Oh,
I can get prescriptions used. I didn't have insurance. You know, you could ostensibly be low income, can't afford insurance. You could just get on and use that. Now, when people go into our offices, we bill insurance or cash pay, and you know that might not be as affordable for folks, but that actually is a pretty great way to interact. Increasingly now, we can interact in multiple languages as we roll out more AI. There's more tools. So I think kind of the takeaway here, and it's a little bit why I talked a little bit about technology, you can reduce the cost of offering things now with Gen AI. I showed you the Hyro, the contact center automation, right? You can have that in different languages. You can have conversations. Whereas if I had to hire humans in every different language, that would be very costly and less accessible. So I would think about how can you now leverage, and it doesn't have to be technology, but how can you leverage approaches to reduce the cost that now makes things maybe more reachable, and maybe allows things to be more culturally competent or culturally, you know, targeted, because, hey, I don't have to hire one person of 1,000 different backgrounds. I could hire, you know, one AI bot of 1,000,000 different backgrounds, and that could be much more customizable.
yeah. Or an AI that understands multiple languages, so you don't have to hire.
That's exactly right, and that's exactly what we're seeing in these kind of these tools now. So I think that can, you know, reduce the barrier and friction. You still have to think about what's your economic model and how are you going to make money on that. But you know, if you could drop the cost, and again, this is where distribution matters. There's a lot of very high revenue, high cost businesses that have to pay a lot of money to acquire the customer, and so they don't make a lot of money. But if you have a great distribution channel, you could be a lower revenue business, maybe a higher margin, like lower revenue per unit, but like, oh, I have a great funnel into this clientele. That could be an amazing business because distribution matters. And so it could be, if you've got, hey, I can target this this migrant population or immigrant population or whatever the population might be, and I have a great way to target them because I really understand how to get to this population, that counts for a lot. And that's why I talked about distribution explicitly. You know, your advantage as an idea or as a business might be, I have a better distribution channel. Maybe my product's equivalent to others, but I can get to the people, I could get to them quicker, faster, cheaper. And you do that, the other company may run out of money, right? Like, and you may be the winner.
That's pretty cool. Yeah, for sure.
Thank you so much for sharing. We also have a couple of audience questions that we really wanted to address. So one member from the audience asked, Dr. Rubin, given how fragmented the healthcare system is in the US, how should startups think about distribution and market penetration?
Yes. So one, I'm not a doctor, so but thank you. They should think carefully about it. So, you know, go back to that concept of the stakeholders. So who are you targeting and how are you going to get to them? And am I trying to get to consumers? Okay, well, how would I get to them? Am I going to do social media, digital advertising, influencers? Is there a distribution partner? Can I partner this with another product? How do you get to them? Is this more B2B? Oh, I'm trying to get to employers. Are there brokers? Are there consultants? Are there advisors? Are there health plans? Or on that supply side, no, I'm trying to sell into health systems or doctors or nurses or clinicians. All right, well, who are the actual purchasers in those healthcare organizations? Who's making this decision? On what criteria they're making the decision? So how do you think about that? Or, hey, I'm trying to coordinate a bunch of these networks. All right, well, how do you fit into those networks? How would you be in the flow of those things? So I think understanding who you're trying to get to, what are the different channels, potential channels to get to them. What are the costs of those different channels? What are the decision criteria? How do those buyers make those decisions? What's the cycle of those decisions? Some of these B2B sales are great. We did really well with One Medical and B2B sales. Some of them took 2 to 3 years. Not so great, right? You're trying to sell to a giant Fortune 500 company. They may not make a benefits decision. Some of them told me, oh, we have our benefits plan for this year, next year. We're deciding for 3 years out. These are giant companies, right? They're not going to make a change in June to roll out a benefit in September. They're like, they may be a year and a half out. That may or may not work in your cash, funding cycle for your business. So understanding these things, or it may work and say, hey, we got to go for some of these jumbo accounts, but we need some small and mid-sized companies that'll make some decisions faster. We need some brokers or third parties who can distribute our product. Maybe we can bundle it with them. And maybe we need some B2C as well, so we can have some other revenue, which is kind of what we did, some combo there. So I think all of that needs some thinking.
Yeah, that's very cool. Yeah, there's definitely a lot to think about, like in terms of your business model, and there's like a lot of nuance in how you can sort of design that. So for people who are interested in the challenge, maybe keep those in mind when you're thinking about your ideas. We have another question from the audience, Friends Haida. He or she asks, I would also like to find out how one could learn to financially sustain the growth and flow of innovations which reach communities that are affected but can't fund it directly.
Yeah, well, financing and funding is key. And so whether I've worked in nonprofits for a large part of my career, and you still need an economic model. Zero economic model, you could be a nonprofit, which means you're not looking to distribute your profits to shareholders, right? But you still need financing. Usually, people who work for you usually want to get paid. You could have volunteers, but you usually have to pay vendors, right, for tools. So I go back to the stakeholders. Who is interested in this, right? Like, who are the key stakeholders, and why does this matter to them? Right? We have nonprofits, we have government agencies. Why would this thing matter? And I often hear entrepreneurs and people in nonprofits are really passionate about their idea, but I'm like, does anybody else care? And I don't say that flippantly, but like, why should other people care? Why should they care about your thing versus somebody else's thing? And so thinking about that, well, I've got a lot of stakeholders that are supporting it. I've rallied people around this. I have people who can make connections, who are influential, or we're helping people on the ground, and there's a lot of users, and that can attract attention. It's got traction. Just like any other startup, like you want philanthropists or a government to invest in something. Well, people are using this making an impact. It's got good hype. There's real case studies. I've published on it. There's good word of mouth. I saw a question in the Q&A here from Julia Lynn. She said she likes the bunny image for hops. What's the role of storytelling in being an effective healthcare innovator? I'd say it's hugely important. And I think to this other question, it relates. You got to be able to tell the story and sell the dream, right? Like, and whether it's reaching hard to reach communities or not, like, why should this matter? And there's, I think you got to use all your influence skills, whether it's storytelling, whether it's graphics, whether it's building networks, whether it's finding people who could help carry the torch for you. All of those things are going to matter in any organization. And then you got to continuously innovate. And to that other question, because it doesn't mean somebody will continue to fund it, right? So that's where the execution matters. Innovate, but execute. You said you're going to do this. You said it had this purpose. You said it was so meaningful. It doesn't matter. Is it moving the needle? Some things are not moving the needle. Like, okay, well, how do we improve upon it? How do we continuously change? I often think, going back to the CI care mentality, go into the field, go talk to the customers, look at the problem statement, ask people, why are they using it or not? And sometimes you could do this remotely and digitally, and sometimes it's pretty interesting to observe, people actually looking at your thing or product. You're like, yeah, I don't know how to use it.
Yeah. Amir, I think you brought up great points about like the idea of, even though it's not for profit, you still need to make it sustainable financially. I think that's a big distinction that, like, I think when I first started learning about healthcare, I also it wasn't like that intuitive to think of. It's like, oh, like this still can't just like throw money away, like, because
Right.
it's not sustainable. And also, I think the point about like actually getting your product out there and testing it out. And I guess I just want to double click. That's kind of our mission, is to help people. Like, idea is just the very, very, 0.1% of like the whole journey, and like being able to put your things out there and pressure test it. And kind of like talk to your customers. These are real, tangible kind of progress you can see that is being made. And I think, Zainab, you said you have another question. So feel free to ask.
Yeah, I have one more question that's likely gonna like round out the end of the session, but I just wanted to ask about also the involvement of people that are maybe taking a more traditional med path. Like, I think for me personally, I've like been less involved in the business side of things, and I would love to be a part of maybe like research and development and just seeing how these kinds of like new AI technologies are involved in the business sphere. But for those of us who don't have much of like an AI background or a business background, like what are ways in which you've seen like your clinicians or like people in your team get involved in other ways?
Yeah, great questions, Adam. I think one of the best things I think anybody can do is go see for yourself. And frankly, it's one of the things we did with our technologists at One Medical. We took every software engineer and we go pay for them to go be in the clinic and go observe. And they're like, oh, wow, that's really different. And also the same with leadership and management or finance. But also our clinicians, like, hey, go see the other aspects of the process, because you're in the clinic, but you don't know how cumbersome the scheduling is, or the routing, or the follow-up, or the insurance authorization. So like, the more you can understand steps of the process, you start picturing things like, oh yeah, this is a mess. Like, sure, I'm seeing the patient here, but then they go home, they don't fill the prescription, they don't understand the discharge instructions, they don't follow up, and they don't book the appointment. Well, gosh, that's frustrating. I wonder why. We actually did this kind of design thinking exercise where we even paid some of these patients, and we said, let us follow you home. And we spent like, we didn't sleep there, but we'd come there for the days and we just watched what they did. And it was so interesting. People calling like their sister in another country, speaking another language. They have sticky notes. I don't understand. They're taking pictures of their electronic records. They're rolling. And so then you're like, wow, this is how people are doing things. And so I think a great way, Zainab, to your question, is go and see, like, oh, and I used to do this as a healthcare leader all the time. I'd put on scrubs and I'd go into the ORs, I'd go to the ERs, I'd go to the loading dock, I'd go into the nursing units, we go into ambulatory clinics, we talk to finance, and you start getting a greater picture of, wow, this is way more convoluted than I even thought. And that's a tremendous advantage, because a lot of people don't take the time to do that because they do their work. They can't see what's before them and after. And so I think it used to be like, just, hey, I'd love to be involved in any kind of process improvement projects. I'd even just love to go tour and see. Same with the tech side. Hey, let me see what people are doing in the electronic health record or otherwise. What do you like? What do you not like? And I think many people don't do that. And so when you do that, you kind of have a tremendous opportunity to learn. And I'll close with, also, this was an old prior CEO at Toyota, and kind of in lean thinking, he would talk about go see, ask why, and show respect. So not bad learnings. Go see, ask why, and show respect. And what you'll often find is people don't know why. Like, I don't know why we do it this way, and there's often a better way. Well, Sherry, Zainab, SHDC team, and everybody joining, thank you so much for having me today. It was an absolute pleasure. I look forward to staying connected and hearing about these amazing projects. And keep in touch on LinkedIn and otherwise. And great being with you today.
Thank you so much, Amir. We'd like to thank you as well for sharing your knowledge and wisdom. And as you know, this is an educational platform. We want to dip into the knowledge, and it's great to hear from you. And yeah, for people in the audience, please keep connected and stay tuned for our new learning series. And we will see you back shortly.
Thanks,
Awesome. Thank you so much. Have a good one.